I know cancer, like 40, I think that the statistics are 40% of us will get it. I know that, but I felt that, I took care of myself. I didn't eat red meat, all of the things that they say, oh, that helps, for you to stay healthy. That went through my mind. Like, I did this and that. Like, I was like, I don't smoke. I can't have, a blood cancer. My name is Renata. I live in New Jersey. I work as a research scientist in bioanalysis. In my spare time, before cancer, I was really into working out, jogging, traveling, just living life. Like I do a lot of things. I like to go out with my friends. That was pretty much my life before cancer. I think around the end of February last year, I started to get tired, symptoms like fatigue. And I thought, oh, maybe I've been working too much. I also became short of breath maybe a few weeks later. And I'm like, okay, this is weird. Anyway, on March 4th, I found out that I was pregnant. So that kind of put everything together. I'm like, oh, that makes sense. I'm pregnant. But I had this feeling, even when I found out that I was pregnant, that something wasn't right. And I couldn't put my fingers on it, but it was just this weird foreboding experience. I think that was, due to the fatigue and, my body was just out of it. So, I was pregnant. I kept telling my OBG-YN, like, hey, I'm having nausea, fevers, like, what's going on? I got diagnosed with the ear infection once. And then they put me on this anti-nausea medication and it didn't seem to help. It just got worse. And I'm like, I didn't know pregnancy was this bad. Like, I got to the point where usually I walk my dog every day. I was out of breath, walking him. At work, my work suffered because I could not concentrate and I was tired all of the time. And and so it just snowballed, it just got worse and worse. And, I just chalked it up as just, pregnancy. I do remember one night saying to my husband, I feel like I'm dying, and he probably thought I was being a little melodramatic, but like, that's how I felt. Like, I was just so tired and I couldn't get enough rest. Even if I would sleep 10 hours, it felt like I didn't sleep at all. And, I would have night sweats, but I attributed that to, the pregnancy, just hormones, I didn't find out until I went to my OBGYN, and how they do a whole battery of tests. So they took like 15, 20 vials of blood. And the next day they called me back, and the nurse, it was a very weird conversation. She was like, hey, your white blood count came back high and we can't deal with that here. And I'm like, we can't deal with that. Like, it was just the way she said it and her voice, it kind of told me that something wasn't right. So I'm like, okay, what should it be? And she said it should be, I think, 4 to 11. I was like, okay, what is mine? 37.8. And I was like, oh, that has to be a mistake, While I'm talking to her, my primary doctor calls and he's like, Renata, I just got a call from your OBGYN. And, they told me that, at the time, I didn't have time to Google anything because I wanted to Google, what is this? But, and I said, the doctor was like, yeah, I think you need to go to the hospital. He said, I'm going to call a hematologist. And I'm like, okay, hematologist, I know what they do, like a blood disorder. So I'm thinking, okay. And I was like, okay. And I was like, could this be like autoimmune disease? Like maybe I have lupus or, and he was like, no, I don't think it's that, but, we'll call you back. And he called back and he was like, go to the ER in Philadelphia. And I'm an hour from Philadelphia. As we drove there, I did Google, high white blood count. And the first thing that came up was leukemia. But I said, I know I don't have leukemia. So, I'm not worried. They redid the test at the hospital and it confirmed that, it was high. That night I had a doctor come in and she told me, it was just like, in a movie. She sat next to my bed and, and I'm like, what is she about to tell me? Like, and she was like, you have some type of blood cancer. And I couldn't believe it. Like it was, I said that, no, I said, I'm pregnant. And she's like, yeah, you have some type of blood cancer. You're going to meet with an oncologist. And, it just, I was in shock. I met with the oncologist and my oncologist was like phenomenal. The first question one of the first questions was this a planned and wanted pregnancy? And I didn't realize the significance of that at the time. I was just like, yes, no question, yes, And she was like, well, we're going to consult with maternal fetal medicine and, we're going to see what we can do. And she said at that time she told me that, I had B cell ALL. She did not know at the time if I had the Philadelphia chromosome or not. So she wouldn't know that result until the next day. The next day she told me I did have the Philadelphia chromosome. Well, she told me that 25% of ALL patients get it. She said it makes it harder to treat and it makes it a high risk for relapse. And I was like, okay, still in disbelief, So, and then I met with maternal fetal medicine and they were phenomenal as well. And the one doctor told me, she's like, we'd rather wait to start chemo when you're in the second trimester. And I was like, oh, okay. She's like, but we talked to oncology and they said you would not make it that long. And like, that was another like moment, like I'll never forget, because I was like, wait, I'm weeks away. I'm potentially weeks away from dying if I don't get, it was just like crushing. And I was like, okay, like that was a really, I don't think I'll ever forget that moment because it made it real. She told me we're going to do everything that we can to get you and the baby, through this pregnancy. They worked very well with oncology. Like, they had meetings. She said, we talk about you every day. We're trying to make up the best plan for you. And so, yeah, that was, the scariest moments of my life. Like just, they gave me statistics, of course. And I knew that, I would be harder to treat because I'm pregnant. And, but they assured me that they believed that they could get me through this pregnancy. And my husband was there, as we were discussing this, and he and I didn't have to talk because he knew that we wanted the same thing. Like, we planned this baby, this is our first child. And, I said, I want to carry, the tough thing was there was a risk. They wanted to wait until I was in the second trimester because there's a risk of bleeding to death, of, spontaneous miscarriage when in the first trimester. I was due in November, but I got to 32 and a half weeks. What happened was I ended up getting meningitis, after my port got infected. So I got meningitis and I was sick. So he, started, his fetal heart rate dropped. And when I say that everything happened at exactly the right time to make sure that he was here, like there was a nurse in oncology who had the sense to call the OBG-YN. It was, and they rushed me upstairs. I had to have an emergency C-section. And, you know, they lost his heart. They couldn't find his heartbeat for a couple of minutes. And, you know, I'm just laying there and I'm like, this, you know, in shock again, but still feeling that, you know, he's going to make it. Like, you know, through the pregnancy, I'm not going to say it was an easy pregnancy, but he met every milestone. He was growing at the right rate. He was perfect, you know, and there was guilt on my part because I'm like, this is my fault because I have meningitis. Like, and now, you know, he's born, you know, he has to be born prematurely, but he was completely healthy. They got him out. I think I went into the ER at 12:09. He was out by 12:33. He was 3 pounds, 8 ounces, completely healthy. He stayed in the NICU for 37 days. That was hard. But you know, now I realize it was almost for the best because I was very sick then too. So I was in and out of the hospital myself. I was neutropenic. I wouldn't have been able to take care of him. But, you know, as for now, he's 9 months. He's met every milestone. He's perfect, you know, and it's through all of this, like, you know, the worst, you know, having cancer, like, you know how they say there's like a pot of gold at the end of the rainbow? Like, that was my pot of gold. You know, it was just like, I forgot that I had cancer. Like, it was just I know all mothers feel that way, but it was just, it's different. The dexamethasone, it was altered. They omitted methotrexate because that's known to cause fetal issues with the baby. So they omitted that. But everything else, also my TKI for the Philadelphia chromosome, they wanted to put me on ponatinib, but that was known to cause, you know, fetal defects. So they tried me on nilotinib. The data was mixed for that particular drug, but at that point, it was, you know, I had to get on a TKI for the chromosome. The hyper-CVAD was, it was divided into 2 parts, part A and part B. Part A, you got 4 drugs. I think, cytarabine, you took this dexamethasone, vincristine, and doxorubicin. Usually it would be 4 nights in the hospital because you would get the cytarabine every 12 hours. So that would be 4 nights in the hospital. The B part would just be cytarabine, but it would be a higher dose cytarabine. And I would be in the hospital for 3 days. Now, at both A and B cycles, they did they checked, you know, to see they checked my spinal fluid. So and I got chemo here too. So each time they had to do that, you know, so I got chemo and that was the hardest part. And I believe that was cytarabine too, and I would get like so sick 10 minutes after they would give it to me, because I was pregnant. Of course, hair loss. That one, that one hit. I think I started chemo May 5th. By about May 19th, like my hair started kind of coming out. So I had my husband give me a buzz cut, and probably by June 1st, most of my hair was gone. So yeah, and they all there were more. I know there were a few of the drugs caused that hair loss. It wasn't just one for that. I do know that. The cytarabine, the main thing was fevers. Like I would get fevers every single cycle. Sometimes I would end up back in the hospital because I had fever and they assumed, they, thought it was an infection, but it was from the cytarabine. Fatigue. The fatigue was pretty bad, but again, I was pregnant, so I don't know how much was from, the pregnancy and how much was from cancer. I noticed during the B cycles with the high dose cytarabine, it made the fatigue worse. So cytarabine was really, for me, was tough. Yeah, so I'm trying to think, did I have any? I didn't have, I had food aversions, like I didn't have an appetite. I think that was a combination of the drugs too. It was tricky for me because I started losing weight, but I was pregnant. Like 1 month I lost like 20 pounds, and it was hard to balance. Okay, I have to eat, because I have a baby too. So they actually gave me, medicine to help with my appetite with that. Brain fog. When I think about that whole experience, it's almost like a fog because everything went by. So it was just, I couldn't remember things. With the nausea, Compazine definitely helped me. I also used these anti-nausea patches behind my ears. That helped a lot. I finished active chemo in October. I had a bone marrow biopsy done in November. I was MRD negative in the clear. The Philadelphia chromosome, my BCR ABL levels were at 0. But my doctor wanted to do blood tests every month to check those levels to make sure. The first month was fine. Around Christmas, the nurse calls me and she's like, "Hi, Renata." She's like, "Your BCR ABL levels came back elevated." And it was just like, and I'm like, "What?" And she's like, "Oh, it's at 0.02. And I'm like, "Okay." But we thought it was because we lowered my ponatinib dose. We cut it in half from 30 to 15. My oncologist did not believe it was from that. She thought that it was coming back. But, I said, "Oh, can we increase the dose and maybe to go down again?" And we did that. The next month, it was 0.01. And I have a conversation with my oncologist and she's like, "Renata, for long-term survival, this needs to be negative. If this comes back positive again, you're going to need a stem cell transplant." And that was that was really devastating to know that the treatment, that it, as much as we tried, it wasn't enough. So, all of January and February were just stressful because I'm waiting for these test results to come back. After, 0.01 in January, February, that's the big month. Like this has to be negative. It comes back at 0.153. So it increased. And when I saw those numbers, I knew that, I would be getting a stem cell transplant. So, that day, my oncologist, we had a meeting and she's like, "Okay, we need to get rid of that trace amount." She said, "So I'm going to put you on Blincyto." And so I started Blincyto, the immunotherapy drug, the next week. That was originally supposed to be a 3-day stay, but I actually stayed for 5 because I had an adverse reaction. My liver enzymes were like off the chart. That happens. I had really high fevers, joint pain. It was so bad, like they had to give me like Dilaudid to calm the pain. And, we thought this would be an easier treatment because she said most people tolerate it well. I didn't tolerate it well at all. My transplant specialist, she's amazing. She's been very positive about, the experience. She's told me I definitely would get diarrhea. She said I'll probably have, nausea. And she told me if you got through being pregnant and chemo. She said, you'll get, I'm not worried about you. I'm like, I am. Like, what? But she did tell me, I do know that statistically 30% of the transplant patients don't make it through the first year. But, reading literature, I found that most of those people are older people with pre-existing conditions, which is why before you get the transplant, you have to get so many tests to make sure that you're fit for it. And, we automatically assume because I'm relatively young that, I'm fit for it. No. We first did, they did an echocardiogram of my heart, and they found that my ejection fraction had dropped from 65% to 45% within the year. I saw a cardiologist. He said he didn't think it was from chemo. He thinks it was from the pregnancy. So that meant that I had to get, more tests done on my heart. Then you have to go and do a pulmonary test. I failed that. And that's because I'm on Blincyto and I'm allergic to the Blincyto. So it's hard for me to breathe, because I was actually supposed to get this transplant this month. I was supposed to get it June 13th, but because of the heart issue and the lung issue, everything has gotten pushed because, and that actually scared me, because I'm like, oh my gosh, I know I need this transplant. What's going on? But right now last week they did another echocardiogram of my heart, and the ejection fraction is back up to 62%. So and then Thursday I have my pulmonary function test again. So hopefully I'll pass that. But that's what I mean. They're very thorough, and even though like I hate, like I want to get this over, I'm glad that they are so thorough, because, a stem cell transplant, it's almost like a factory reset of your body. And, it takes a lot out of you. So, I appreciate them wanting to make sure that they get to the bottom of everything and make sure, I have the best chance of getting through it. And my doctor did say there's a 70 to 85% chance to secure it. So I think that those are good numbers, compared to me not getting the transplant. So, in that aspect, I feel blessed. I want to get it done and over with so I can move on. But I feel like, my doctors are positive about, they haven't scared me yet. Usually when my oncologist, because usually I can tell when it's like, hey, Renata, but she's been positive, she's glad that we figured out, where this allergy was coming from. So yeah, so that's kind of where I'm at, just waiting. You have to be positive. I mean, that's the main thing. People say to me all the time, like, oh, if I were you, I would be depressed. And I'm like, why would I be depressed? Because that's not going to fix this cancer. It's not. There are a lot of things that knock you down, like, the side effects, and sometimes you want to quit. But when you feel that urge to quit, whatever, I don't know if it's your dog, your kid, your spouse, you have to have something to hold on to something to look forward to in the future. Like I said, stay positive and keep, with friends and family. If you need help, don't be afraid to ask for help, because you need a good support system around you.